Dr. Gray and I'm the oncologist on the unit, and this is Izzy, she's going to be your primary nurse for today. So we're here to discuss the results from your biopsy and all the other tests that were done.
This is my husband Derek and my sister Christina.
Hello, nice to meet you all. So Meredith, can you tell me what you know about your diagnosis thus far?
Just that the lumps that I found in my breasts were suspicious, and we had a biopsy done, and now we're waiting for the results. What are the results?
Well, I'm afraid I actually have some bad news for all of you. Your biopsy showed that you have stage 3 breast cancer, and it is an inoperable form.
What? No, this can't be happening.
What does this mean exactly? Well, basically the cancer in Meredith's breast has spread above her collarbones into the lymph nodes, and because of that, it effectively will do no good. So what we can do now is talk about what we can do.
What about our baby? I just found out I was pregnant. I'm about 2 months, almost 3.
Well, there are some options available. One of the options is to terminate your pregnancy and start you on some aggressive treatment. However, if the treatment is successful, you won't be able to get pregnant for the next 5 years. The other option is to wait till your second trimester. That way, the chemo drugs will not affect your baby as much. However, I can't guarantee you that in the long run, the baby will not have any abnormalities again. I can't say that right now. I know this is a lot of information for all of you to take in, so I'm just going to give you some time, and Izzy will be here to answer any of your questions, okay?
Thank you.
For you to digest. Tell me more about how you're feeling.
Well, to be honest, I'm in shock right now. Last week I was pregnant, I was excited, and now today I have cancer and I have to decide whether or not I can get rid of my baby. Next month I'll be 36. I was 28 when we started to try and get pregnant. I've already lost 2. I can't imagine losing this one.
Meredith, will you just forget about the baby?
Derek, I can see that you're really angry.
Well, my wife's just been given a death sentence, and all she can think about is the baby. I don't want to lose her. I can't lose her.
Derek, you can't just pretend the baby doesn't exist. You know how much she wants this. Meredith, the doctor said that you could wait and start treatment a little later. How much damage can you really do?
Lots of damage. She could be dead by now. I just don't see what the question is. When can we start treatment?
Derek, you're very upset right now.
Of course I am. You don't think I wanted this baby too? But if I have to choose between losing the baby and losing my wife, of course I want to save my wife. I can live without the baby, but I just can't live without Meredith.
I understand that this is very upsetting for you.
I just want to think about getting Meredith better, and so our priority right now should be to just get rid of the cancer.
Derek, I understand that this is a scary situation. I think we need to thoroughly explore all the different options now before you can make a decision. Treatment is one option. Meredith, what is your biggest concern right now?
I don't know what to do right now. I think my biggest concern right now is making the right decision. I don't want to lose this baby, but I don't want to die either. What happens if I don't do the treatment and I die? Would you be mad and blame the baby?
I don't know, Meredith. This baby means a lot to me too, but I just can't think about that right now. I just don't want to lose you.
Izzy, do you think you could go over the options again?
There are a few options, and I'll do my very best to go through each one with you to clarify and to answer any questions that you may have. Firstly, since you are in your first trimester, we can terminate the pregnancy and begin chemotherapy as soon as possible, with the option of using radiation in conjunction. Do you understand what that means?
Yes, we lose the baby and start treatment right away. Look, Meredith, that's the best option.
Wait, Derek, hold on. She hasn't gone through the other options yet.
If you decide to keep the baby, we cannot use radiation since there is no method to effectively shield the fetus. could delay treatment until the second trimester, where it is less likely for chemotherapy to cause spontaneous abortions or fetal malformations. We would do an ultrasound prior to each round of chemo to assess for fetal growth.
But, okay, so if Meredith decides to keep the baby, what's the risk of delaying until after she gives birth?
Mothers often request a delay in the start of treatment out of concern for their fetus. But delays of 3 to 6 months have shown a 10% increase in the risk of the cancer spreading. So there's an even increased risk of the cancer spreading if we wait until after Meredith gives birth.
And if I choose chemotherapy in my second trimester?
While there's a lesser chance that the cancer will have spread, but there's an increased risk for preterm delivery, and there may also be some developmental risks for the baby.
I don't know what to do. I don't want to delay treatment, but I don't even know if it'll work.
I see, what's the life expectancy for stage 3 breast cancer?
Well, the prognosis has been documented as a 5-year survival rate of 36%. This varies depending on the patient. There are no sure answers. Right now, we need to take some time to discuss your feelings and consider all your options. This is a lot of information to be taking in right now, and it can be very overwhelming.
Yes, but the sooner we act, the better. I really don't want to push you into treatment. I want this baby too, but what if you miscarry again? Should we risk your health over something that we're so unsure about?
Derek, don't talk like that. What if I was to die either way? Would you want me to keep the baby then? Or what if I start chemotherapy and I'm better and then we have a sick baby? I can never forgive myself.
Meredith, you'll be fine. The baby will be fine. We don't have to assume that things will turn out badly. Derek, I'm not being naive, but we don't have to assume the worst. Don't you think that even if Meredith had less time, she'd want to spend it with her family and her new baby? The worst thing for her right now would be to start treatment stressed and depressed, that she just had to abort the baby that she's been trying so long to have.
Meredith, I can see that you have 2 very committed people in your life who will support you through this experience. It's an upsetting situation for the whole family, and you all have to understand that Meredith is not the only one experiencing this ordeal. Everyone will be facing their own personal challenges to adjust into this new situation. Derek, it's natural for you to want to take charge, and your organization and focus will be essential. And Christina, your positive outlook will be a source of strength for Meredith. But right now, I think all you need is a little bit more time.
Derek, I know you want to focus on just me, but it's not just me anymore. We're having a baby. I think deep down I've already made my decision. I can't give up on this baby. I hope I'm making the right decision.
So you want to start chemo in a month? And that way there will be less risk on the baby and hopefully your cancer won't have spread by then?
Yeah, I think that's the best course of action right now.
Do you have any other questions about the treatment options or anything that we've discussed?
No, not right now.
Well, I'm just going to give you some information that the doctor has outlined about your treatment options. If you have any questions at a later time, please feel free to contact me or the doctor.
Thank you.